Doc Leon here, everybody, the BYG Nation. Remember, BYG stands for Be Your Greatest. I wanted to share some knowledge here with a patient that brought some things up earlier today, where he's been a dietary patient for years, and it's really special. He's now partially retired down here in the state of Florida, still managing his immune system well, but really enjoying life right now and eating out at restaurants and kind of off his program for years and years. So he's recently now come in. We're helping with neck and shoulder issues, and he's seeing his digestive system improve just from the adjustments and going in the oxygen chambers. And right now I'm walking around BYG campus, and it's a very, very special place. But I wanted to speak on a symptom that just came up because he's really avidly going after playing golf. And it's called plantar fasciitis, where the bottom of the feet tighten. Sometimes symptoms creep up the heel, through the Achilles tendon, and up the calves. Now, this is not something he deals with. It just came out of nowhere, but the correlation, or maybe a coincidence, or what I call is a God incidence, that he really went after golf the past week. Played quite a bit. And there's a lot of rotation, everybody, that goes down into hips and the knees and the ankles with the planting and the rotational twist. And it's to my experience, 24 years in practice, that plantar fasciitis mainly is a protein issue with the proteins the person is eating. And when they lay down at night, what we call is horizontal, where we teach people how to get horizontal with their legs elevated, that the kidneys, the liver, the pancreas, and if you have a gallbladder, gets involved. And now these organs, known as your hepatic organs, start to clean your bloodstream. Really, really, really special that this happens every night when you get calm and these innate systems just naturally do their thing. Typically, we're all asleep, so you're not aware of it. But plantar fasciitis is when proteins pull in the feet, create inflammation, and the tissue tightens. Now, some people would be listening to this and be like, yo, Dr. Leon, you talking about gout? Like, yeah, that's when the big toe starts to hurt, right? Well, yes, that is affiliated with proteins and then acids that then crystallize and create symptoms in the big toe. Plantar fasciitis, to our experience, is when that person is eating proteins, their body and their kidneys are not using them well, and the proteins stay in the feet, the acid builds up, the tissue tightens, soft tissue, muscle, ligament, tendon, and nerve, and now you have an awareness. A lot of people that do performance psychology counsel with me with my continued BYG programs, they know we really use the language of awareness to keep control over the mind, so we can govern our tempos properly and perform at a massive level, and don't use the word like pain. Now, the other aspect of plantar fasciitis, where I was just telling you the story, and this person happened to play a lot of golf recently, and he manages himself somewhat nutritionally well, but he's just really having a smorgasbord the past couple of months. He's down, retirement, restaurants, enjoying life. He's worked super hard for a super long time. And who wouldn't love to just enjoy that? I think we all have something like that on our dream board. And you want to be super healthy when you get there in time, so you can be aware of your immune system. You know the symptoms of how your immune system is talking back to you. And then for my dietary patients, do recovery days. So in this aspect, though, his subluxation came from the knee. A lot of rotation and twisting, playing golf. His fibula head subluxated. That's the outer part of the knee. Everybody watch my camera. Right down here on the leg, that bump right out on the outside of the leg. That's called your fibula head. And when the fibula head subluxates, it now causes all different types of symptoms that go down to the foot. And it was very simple to see on today's athletic adjustment for him, that when we checked a couple things, the fibula head was out, adjusted it, then went through what we call as a full lower kinetic chain adjustment, adjusted the ankle, adjusted every bone in his foot, then went up and made sure that the opposite side of the leg, the knee, and the foot on the upper neck was adjusted so the cerebellum locks that in. That's the back part of your brain. So in this case, it was more of biomechanics in other aspects, because guess what, everybody? The bottom of the foot was not tight. The bottom of the foot was just tender and starting to get achy. This was more biomechanics. However, a lot of the time, plantar fasciitis, when people are dealing with this symptom for a very long time and it doesn't just come up, that is a nutritional issue where the proteins are pulling in the feet. And I would urge that person to really start looking into doing some individualized nutrition so they can find out what proteins may be right for their immune system. God forbid they're killing off white blood cells that deal with your kidneys, called mixed cell mast cells, because those are female and male hormone cells. And if this sounds intriguing and exciting and you're enjoying this published piece of media, stay tuned, because we got great things coming. To be great, all you have to do is start. The next step is stay consistent and focused and work at it. And there's a lot of exciting things happen behind the scenes. I'm Dr. Leon Melman. Thanks for tuning in. And remember, we all have an amazing energy in common that thrives inside of us. And it's your BYG spirit. We all are focused and wish to be our greatest. Be your greatest. See you soon.